Are you at the point where you have tried everything else and now you're seriously considering getting neck or back surgery? Well, before you make that decision, listen up. Dr. Miller from Total Health Chiropractic. He's helped hundreds avoid going under the knife, and he may have the answer you're looking for. Good morning, Dr. Miller.
Good morning, Todd.
And welcome back to the show. Let's talk about spinal stenosis. Two main questions. What is spinal stenosis? And then what exactly happens when you get back surgery? What are they doing in there?
Sure. Well, spinal stenosis is sort of a broad term, but basically it just means narrowing of these nerve openings. And when you look at these models, there's a couple nerve openings in the spine. You have your central canal through the vertebrae or the bones where your spinal cord goes through.
Okay.
And then you have these openings on each side called the foramen, where these nerve roots exit off out into our bodies.
Okay.
And so these openings can become smaller. Many times it's due to things like a degenerated disc, where you can see down here this disc is much thinner and degenerated. Because of that, the bones become closer together and that opening becomes stenosed or smaller than the model that you have.
I always wondered what the stenosis meant. This means it's narrowing, getting smaller.
Other times, Todd, if they have bulging or even herniated discs, these discs actually push right out into those openings and make that smaller. And you know, when you have the narrowing of the opening, it starts to irritate these nerves, and it can cause a lot of pain in the neck or back. And these nerves also go into the arms or the legs and can cause problems there. And so with surgeries, and obviously I'm not a surgeon, and there are times surgery is necessary, especially if you have loss of bladder or bowel function, but many times it's avoidable. They're cutting things out, they cut the bone out, they're fusing these together with rods and screws many times to stabilize that segment. And there are a lot of risks involved with that surgery, anything from death. Sometimes there's nicking nerves or paralysis. Other times patients can develop a pretty bad infection that has to be dealt with. But there's other consequences. Even if patients go through this surgery and get good results, it's usually short-lived because, Todd, every level of the spine takes on a certain amount of stress. So when you start fusing these areas together, the stress is redistributed above and below the fusion, and then those levels wear down quicker than normal and they become a problem, and that's where patients continue to get these surgeries over and over again.
And we're going to look at some x-rays right now. These are some specific examples maybe you could walk us through.
Sure, this is actually an MRI on the left and x-ray on the right of one of our patients going through our decompression program, and this gentleman actually had 3 surgeries in his lower back, and you can see on the right on those x-rays, those are some pretty long screws with a couple rods there. They've bolted his spine together at that level. But then on the left is the MRI he had recently done, and you can see those arrows are pointing to the discs above the fusion, and they're black because they're drying out, they're thinning down, but specifically what those arrows are pointing to is bulging discs where they're pushing out into these foramina and central canal, causing that stenosis everybody talks about. And that patient had a lot of back pain and didn't want another surgery because he wanted to put a stop to that. So we're actually fixing those levels with my decompression program, not only to help them feel better, but to avoid future surgeries.
And that decompression program is the DRX 9000. See, we just got we're getting a shot of it right now. To explain exactly what's happening for this patient.
So Todd, this is a computerized medical device. Computers are working with a patient, controlling how this works, but it effectively and non-invasively reverses these conditions by specifically stretching that one individual level of the spine. So that's why we can work around fusions, program it to work the levels above or below. But it basically draws those herniations back in off of the nerves, back where they ought to be, and at the same time draws moisture and nutrients in the discs. So they literally regenerate, and our patients get great relief because, you know, we're correcting the problem. We're not just masking the pain or shifting stress to another part of their body.
Absolutely. Well, along with surgery comes those pain medications too that people want to avoid, not to mention the cost. I mean, there are a lot of side effects.
Downtime.
And the downtime that you're down from work with surgery. Nobody wants to go under the knife. It's usually a last resort. So this DRX 9000 can really be an answer for those. And you mentioned something that maybe a lot of people don't realize. If they're thinking, I could consider back surgery, I'm at that point. That might not be the answer that's just going to take you to the rest of your days. As you said, that gets redistributed, and sometimes it doesn't last very long. I think you have a testimonial from Alice, where we have some video where Alice can talk to you about it.
Yeah, so Alice had done our decompression program. Like a lot of patients, she had gone through the physical therapy, she'd gotten the shots at pain clinics, even did get the surgery. And she actually did improve a little bit from those things, but the pain returned because, again, they didn't fix the cause of that pain. And she did our decompression program.
It says right there, I mean, the surgery, the relief that she got only lasted 7 months. That's not even a year.
Yeah, I mean, it's not very long. The spine's supposed to move, and when you just bolt things together, you get other problems.
Sure.
So, you know, we were happy to help Alice, and there really isn't any downtime. You just keep living your life. You can work if you need to. And patients a lot of times just sleep during the treatment because it's so relaxing. So
Sounds like this
it's a
could
pretty
be,
big win for them.
could be the answer to a lot of people's problems. So let's get them this new patient special right now. Go ahead, $49 consultation and examination. What does that entail?
So Todd, when they come in, we're going to talk and meet in a consultation and talk about what they've done before and what their symptoms or complaints are. And, you know, we want to diagnose their condition and know what the problem is. So we do a thorough exam. If they call today, they can do that for $49. And then for your first 3 callers, I'm going to throw in a free set of x-rays so we can show them what's wrong and they can see with their own eyes why they're hurting and, you know, talk about solutions to get that fixed.
That can be key, to be able to see it yourself, right? So
Sure.
we want to get you there. Call Dr. Miller's office, 616-828-0861. Right now, if it's busy, continue calling. They want to talk to you and help solve this neck and back pain. 828-0861. Thanks again, Dr. Miller.
My pleasure. Thanks.
Appreciate it. Still ahead.